Hello everyone, I'm Dr. Abu Zari from Kurdistan University of Medical Sciences. This content is produced to international medical students. Subclavian artery. This artery at the left originates from arc of aorta, but at the right originates from brachiocephalic trunk. See, this is brachiocephalic trunk. It has two branches, right common carotid and right subclavian artery. So, subclavian artery has a different origin. But, either or left or right, it has three parts. First part goes from the origin to the medial border of scalenus anterior muscle. See, first part of subclavian artery goes from the origin to the medial border of scalenus anterior. Second part is located behind this muscle, and the last part goes from the lateral border of scalenus anterior to the outer border of first rib. So, this is right subclavian artery in the lateral view. The branches of the first part. 1. Internal thoracic artery. It goes down until the 6th costal cartilage. And as you see at the picture, this internal thoracic artery has branches, is called anterior intercostal arteries. 6 pairs of anterior intercostal arteries originates from internal thoracic artery. The next branch is thyrocervical trunk. Thyrocervical trunk. This branch is split into 3 arteries. First, inferior thyroid artery goes to thyroid gland. Inferior thyroid artery. This is transverse cervical artery. And the last branch is suprascapular artery. As you see, this artery goes to supraspinatus and infraspinatus muscles at the back of the scapula. So, this is thyrocervical trunk with 3 branches: inferior thyroid, transverse cervical, and suprascapular artery. The last branch of first part of subclavian artery is vertebral artery. This artery supplies the brain, ascends in the transverse foramen of cervical vertebra, and finally goes to foramen magnum of the skull, and finally reach the brain. The branches of the second part. This is costocervical trunk. You see, this branch divides into 2 arteries. Deep cervical artery that supply back muscles of the neck and highest or supreme intercostal artery that supply first and second intercostal spaces. This is first posterior intercostal artery and this is second posterior intercostal artery. As you know, thoracic aorta has 9 pair of posterior intercostal arteries. For the 3rd to 11th intercostal spaces, but first and second spaces supplied by the supreme intercostal artery, a branch of costocervical trunk. So, internal thoracic artery has anterior intercostal branches, but we have posterior intercostal branches too. First and second spaces supplied by the supreme intercostal artery, a branch of costocervical trunk. Other spaces supply from the thoracic aorta. So, a brief review: internal thoracic artery, thyrocervical trunk with 3 branches: inferior thyroid, transverse cervical, suprascapular artery. This is costocervical trunk with 2 branches: supreme intercostal artery and ascending deep cervical artery. We have ascending cervical artery here. See, ascending cervical artery. It's a branch of inferior thyroid artery. It is anterior to the neck. But deep cervical artery is back of the neck and it's a branch of costocervical trunk. Deep cervical artery, ascending cervical artery. Both of these arteries has a ascending course. Look at the picture, please. This is right subclavian artery. This is thyrocervical trunk. This is inferior thyroid artery. This is ascending cervical. This is transverse cervical artery. This is suprascapular artery. And this is the last branch of subclavian artery. The name is dorsal scapular artery. Dorsal scapular artery. Sometimes maybe this artery originates from second part, but in most cases this artery originates from the 3rd part. Dorsal scapular artery goes to back of the scapula and supplies back muscles. For example, levator scapula and rhomboid muscle. Look at the picture, please. These are internal thoracic arteries that originate from the first part of subclavian artery. They goes to 6th intercostal space and terminates here by a split into 2 branches: superior epigastric artery and musculophrenic artery. As you see, musculophrenic artery has branches. These are anterior intercostal arteries. 6 pair anterior intercostal arteries originates from internal thoracic artery, and 3 pairs originates from musculophrenic artery. This is superior epigastric, one of the terminal branch of internal thoracic artery, and this is musculophrenic. These are anterior intercostal arteries. Look at the picture, please. Subclavian artery is the primary source of blood supply to the upper limb, as well as thoracic wall, head, neck, and brain via its branches. I told you it has 3 parts. First part, medial to the scalenus anterior. Second part, back of this muscle. And last part goes to lateral border of scalenus anterior to outer border of first rib. After that, this artery changes his name, and the name would be axillary artery. So this is subclavian artery. After passing from outer border of first rib, the name change into axillary artery that supply chest wall and upper limbs. This is internal thoracic artery. This is vertebral artery. This is thyrocervical trunk with 3 branches: inferior thyroid, transverse cervical, and finally suprascapular artery. Best wishes for you. It was a brief review of subclavian artery.